Good day, it's Dr. Rapiti. Welcome to another video. It's Tuesday, the 28th of May 2024, and in an earlier video this morning I spoke about a patient presenting with flu-like symptoms and being severely short of breath. She thought she was going to die. And lo and behold, this morning, again shortly after, I had another patient who was extremely short of breath, had a flu a month ago and come back with a flu, extremely short of breath. And I was using my typical instrument. This may show it to you again. This instrument here, the peak flow meter, which is my go-to instrument. And I found a peak flow of 50. She denied any history of asthma. So I was a little puzzled, what's going on here? My suspicion, are we dealing with another COVID situation? And then it turned out we put her on oxygen, and she, a peak flow then from 50 went up to 200. You must bear in mind, a peak flow of 50 is almost 1/12 of what should be a predicted of 400. So she was extremely short of breath. She never had a history of hay fever, of asthma. That's what she told me. But after putting on oxygen, a peak flow went up, and that told me there was a reversible component. What is strikingly important in this particular patient, as with my previous patient, is that both their chests were clear, they had no wheeze, and on probing into the history, both the ladies told me they did experience shortness of breath from early childhood and thought they were unfit, and in change of weather, change of season, both also admitted sneezing and hay fever during the pollen season or when they're exposed to dust. So here again, it's proving the point that you've got to be careful when you're dealing with somebody who's got shortness of breath. Don't rush to the diagnosis of making a COVID pneumonia or some serious illness like that. But what I want to stress at this time is that the worst thing you can do is give them cough medicines. Yes, they do cough. And to give them flu preparations that dry up the secretions. That's the last thing you want to give. You want people to have phlegm that is loose by getting them doing steam inhalation, and to treat the cough. And to treat the cough, ideally the pump you would use is something of this type, which is a Symbicort or any steroid pump, because what that would do is stop the inflammation that's causing the cough. And remember, when you have a flu, your asthma tends to come out, and it comes out worse. And the asthma symptoms remain for almost 3 to 4 weeks. It doesn't mean your flu is not going away. It's just that the asthma's taken you on badly, and you've got to treat it pretty aggressively. So be careful not to be taking cough medicines. I've never believed in them, and flu preparations. I'm not going to mention the trade names, but they all have a component called ephedrine, and these dry up secretions. And the irony of it all is that doctors then tend to give a tablet called, I'm not going to mention its name, but also to loosen the phlegm. So they counterproductive. One is drying and one is loosening. It's like a tug of war, wasting money. All you need to do is drink at least 8 to 10 glasses of water to liquefy that phlegm. Wash the noses and throat with salt water. But let's hear from the lady herself. What did you experience, ma'am? Did you know that you had asthma before?
No, I didn't.
How long have you been feeling short of breath in your life?
It's been forever, but I thought it was just a cough and a cold that I had.
And you were unfit all the time?
Yes.
And you had no family history?
No, there's no family history with asthma.
And you never took part in sport as a child because of your shortness of breath?
Yes.
Okay. And now how are you feeling?
Much better.
Yeah. Now here's an example. It's so easy. Peak flow, take a good history, and God forbid, if this NHI goes through what the government wants us to do because of shortage of doctors, we need to go through patient within 6 minutes. It takes me approximately 20 to 25 minutes to assess a patient like this. But good for her, because I make a proper diagnosis, proper treatment. She's better. She now knows why she can't lose weight, why she's so unfit. If you treat the condition properly, there's no need to be worried about anything. So be careful before you get into running into thinking you've got COVID pneumonia with shortness of breath. Exclude asthma. For doctors viewing this video, please look for asthma. Take a good history. Give them a trial of the pump and see what happens. Take care. God bless. Dr. Rapiti.